I'm Taryn Vian. I'm Associate Professor of International Health at the School of Public Health, and I've been here since 1999 working in the field of anti-corruption and health policy. I became interested in corruption really from a student who went to Venezuela, and while she was on a practicum there, she suspected corruption, and she talked to me about that experience. And I realized as I was helping her kind of decide what she should do, whether she should blow the whistle, that this wasn't just an individual issue of ethics, but that it was really also a public health problem, that the fact that this organization lacked integrity meant that resources that should have been used for achieving public health goals were instead being lost, and that there were lives that were lost because of that. In the health sector, things start to fall apart when there's a lack of transparency and accountability. This is a story told by a nurse in Albania of a man wearing burlap bags on his feet, so poor, dirty clothes, and came in. He's holding a baby. The baby is gray. The baby is definitely very, very sick. And the emergency room doctor starts negotiating for the informal payment. Well, do you have 100 lek? How much can you pay now? Can somebody bring the rest of the money later? And the nurse said she just ran in and grabbed the baby out of the hands of the man and went to try and resuscitate the baby. And she was telling the story because even among the caregivers, they understand that one of the drivers of informal payments is that people don't get enough salary. But they've become inured to people's suffering, and so they forget the fact that people are dying, they're ill. I think sometimes governments are open. They understand that there's a problem of corruption and that it needs to be directly addressed. Sometimes governments, though, they're not accountable and they're part of the problem, so they're not going to start a solution unless they're pressured. And therefore, one of the important things to do in anti-corruption is to work with populations at the grassroots and to help people understand their rights, understand what they can expect from government. You really want people to understand that corruption is not acceptable, that they don't have to live with it. It's not something that there's nothing you can do about it. And if you start to help people see that corruption is abnormal, and you give them mechanisms to raise their voice and say, hey, I've seen this, I don't like it, it's not right, then you can start to intervene and really reduce corruption.